Personal Plan for Innovation and Leadership in the Doctorate of Nursing Practice Role. Presented by Liliana Prakasam, Bradman University. I chose the Watson theory of human caring as my conceptual model for my nursing practice. This philosophy was developed in 1985 by Jim Watson. The fundamental thesis is that humans are not objects, that humans cannot be separated from self, other, nature, and the larger universe. Mind, body, spirit. The major elements of her theory are the 10 clinical Caritas factors, the transpersonal caring relationship, and the caring occasion and caring moment. The first one, the 10 clinical Caritas factors, includes practice of loving kindness, instillation of faith and hope, sensitivity to self and others, helping trust relationship, expression of negative and positive feelings, creative problem solving, teaching and learning, soul care for self, assisting with basic needs, and creating a healing environment. The second element of theory of caring is the transpersonal caring that occurs when a nurse genuinely is present and considers an individual as a whole, regardless of illness and diseases. The nurse here goes beyond the nursing process. The use of music, aromatherapy, tai chi, massage, reflexology, sounds of nature, behaviors, body language, all contribute to a transpersonal caring connection, a goal that a nurse should establish with each and every patient. The third element of Watson theory is the caring occasion, caring moment. It's the moment when a nurse and the patient make a special connection that is heart-centered in a human-to-human transaction that is meaningful, authentic, intentional, honoring the person, and sharing human experience that expand each person's worldview and spirit, leading to new discovery of self and the other and the new life possibility. My strengths for the DNP program. I see myself as caregiver. The caregiver guides the client through the process to provide them with a comfortable and human-centered experience. If a patient feels that the healthcare provider cares, they are more likely to engage in their care. In the 10 phases of innovation, the collaborator creates opportunity to team members to assume new roles. I see myself as a collaborator. For instance, I was in charge of training new providers in my institution, not only on how to use the electronic health records, but to utilize the community resources to improve patient outcomes. As participative leader, I value teamwork in the interest of getting things done. I like to encourage and motivate group members to achieve goals. Also, to accept the input from group members with specialized knowledge and expertise to create a more complete basis for decision making. Being a learning persona, as described in the 10 phases of innovation, the cross-pollinator is armed with curiosity, an attitude for learning, bringing new ideas from the outside world to improve the organization. For example, I help in my organization to implement a third-party system which helps providers and coders with the transition from the ICD-9 to the ICD-10. Evaluation of opportunities. Applying evidence-based knowledge and data to decide a course of action in the future. Recognizing the appropriate environment and circumstances to develop ideas that are desirable. Utilizing new advances in technology to create unique, practical, and sustainable nursing interventions to improve patient outcomes. I will embrace the DNP essentials as developed by the American Association of Colleges of Nursing to have a better understanding of the research process and nursing theories, to be aware of different quality improvement models, and to know when and how to apply them, to have an understanding of the evidence-based practice to improve patient outcomes, be able to implement technology, be active in healthcare policies, being effective team leaders, and be prepared to play a central role in establishing interprofessional teams or to form networks with different health specialties. Also, be able to facilitate disease prevention, for example, by promoting Healthy People 2020. Lastly, to be prepared to practice in an area of my specialization. Nurses should achieve the highest levels of education and training, and to have the commitment to continue learning. Developing a plan is not easy. It requires multiple stages. It's time-consuming. Start with a pick-up question. Conducting extensive literature research. Recruiting collaborators and key stakeholders. Getting the approval on the clinical side. Completing the intervention. Get the data collection, analysis and results. And lastly, presenting the scholarly project. My pick-up question. How effective is an organic plant-based diet and lifestyle modification in reversing insulin resistance in diabetes type 2 in the adult Hispanic patients with hemoglobin A1c greater than 9 compared with the conventional ADA guidelines? In the United States, recent studies have estimated that over 21 million people suffer with diabetes and 8.1 million with prediabetes. Among Hispanic adults, those living in the United States are suffering from diabetes with ages greater than 20 years. 8.5 from Central and South America, 9.3 from Cuba, 13.9 from Mexican Americans, and 14.8 from Puerto Rico. I propose implementing a protocol which includes lifestyle changes to reverse diabetes and the complications, such as amputation, heart disease, stroke, blindness, and kidney failure, among others. In spite of the many complications associated with diabetes with current medications, the approach has been to manage the disease instead of addressing the possibility of finding a cure or reversing the disease. How to engage people to help you. Be part of the process. Developing confidence and enthusiasm. Enlisting the support of family and significant others, including key stakeholders, providing and understanding patients' needs. Lastly, offering them a practical and sustainable approach. As a future innovation leader, I need to be willing to adopt new ways of doing things, not just by the book. I need to be more optimistic, improve my communication skills, be more passionate, has vision. Even though I sometimes use storytelling to improve patient compliance, I feel that I need to improve this persona by including more technology such as video, narrative, animation, or even comics. Plan for my future as a DNP. To keep open mind to improve clinical outcomes based on evidence-based practice by utilizing innovative technology and leadership to engage not only patients but significant others into their care. Thank you.